Good day, students. And for this video, I want to share information and the techniques for massaging a stiff hand. Right. So if your hand, I'll hold my hand like this, and let's say the hand is stiff in this position, which it often is. It's often wrist in slight flexion, MPJs, metacarpophalangeal joints in extension, and your PIP joints, proximal interphalangeal and distal interphalangeal joints. So PIP, DIP joints in slight flexion. So this is often how a stiff hand presents. Can you imagine a patient sustaining a burn, that this is that relaxed position the hand pulls into, but causes a lot of problem with stiffness. So let's now say no burns, but a stiff hand. How are you going to manage this? And also then use your massage techniques. So it's clear to see that it's not just soft tissue that's at fault here, but the actual joints are stiff. So you'll see in your example of your OSPI sheet that it talks about physiological movements and accessory movements. So what are they? Physiological movements are what the patient can do by themselves, right? So you can start moving from the wrist, you can extend your wrist, you can flex your wrist, right? You can also pronate. It's almost like you're eating soup. Supination, and you can pronate. So those you can do 10 repetitions of each. Right, then you go on to your metacarpal phalangeal joints and make a tabletop straight. Tabletop straight, and let your client repeat that 10 times. Right, now we go on to the PIPJs and the DIPJs. What can you do? You can do a hook fist. All right, you can see a hook fist, the way you carry shopping bags. All right, so let's repeat that 10 times. So these are examples of physiological exercises you can do. Also, don't forget about the thumb, very important. Thumb in the palm and out, far out, in, far out, in, far out. Now touch each finger. We call this opposition. Beautiful. Okay, repeat that. Physiological exercises for a stiff hand. Now make a fist and open up. Make a fist and open up. Do you see how much more flexion there are at your ring and little finger sides? Beautiful. Now, accessory, what's the difference? Difference is you can't do it for yourself. It's when your fingers are stuck like this. So then you, as their therapist, bends it down, stretch, open. So accessory movements. All right. Also stretching. You can do that at the finger as well. So you take your client's finger and you stretch, flex, and you also extend. Not everything is for flexion. You also need extension of the finger. So you can stretch into extension, hold it there for 30 seconds, and you can flex all the joints in. Beautiful. Then you can start by massaging on the kneading on the hypothenar part of the thumb. Inside the palm, you knead your one hand on the thumb side, thenar side, and the other hand on the hypothenar side, and you massage and massage. Right. Then each finger gets a chance, and you knead from proximal to the distal tip. Now the ring finger, and you knead and you knead and you knead. Each one gets their chance. After that, then you go on to the index finger, and don't forget about the thumb. Don't forget to knead here in the first web space of the thumb. And then you effleurage up to the elbow. Effleurage up to the elbow. All right. I hope this has been helpful, and telling you more about massaging a stiff hand. Take care, everyone.